Hi, Tabitha Butcher here. So for our assessment video that we watched, which I absolutely loved, the first video, the errors that I noticed in there, which it was listed there were 6. So the ones I thought were number 1, no hand hygiene was performed, which is obviously one of the number 1 things that we're taught. So no hand hygiene was performed. There was no introduction on the nurse's behalf, like, hey, I'm Tabitha, I'm going to be your nurse today. She didn't identify the patient with 2 identifiers, didn't get a name, birthday, just asked how old the patient was, which he replied 69, although he looked 39. So we didn't get an actual identification on the patient. During the assessment, she didn't ask about pain, like the pain scale rated on a scale of 1 to 10. Also, she wasn't wearing a mask, and I added that because in the other videos, they pointed out that, oh, like hey, have your mask on now. So not wearing a mask. And then also a key factor in this video was that she didn't ask about any patient allergies, which later on in these videos, you'll notice why that's so important. So on the second video, there were no temperature probes, so she just didn't check the temperature, which is really negligent. It's important to get the temperature. There was no inspection that was done. She kind of just jumped right into auscultating, and the auscultating was actually done before palpation, so those are 2 different ones. So no inspection on the abdominal area or anywhere on the head-to-toe assessment, and then auscultating before palpating. Her mask isn't covering her nose. It's literally just like this, so it's not doing anything if you're not covering your mouth as well. There wasn't a good blood pressure reading that was taken. It was kind of just put on there, and it was like, oh, well, yeah, I didn't really hear a good reading, so she didn't get one. She didn't try it again or anything. When she leaves that patient's side, she leaves the side rail down and just leaves it down. She never puts it back up, so that's a huge risk right there for falls and having to do a whole incident report. Also, number 7, I put when she's checking the patient's back, like for tenderness, when you would be, putting your fist up and pounding, she's really going at it, hitting the patient really too hard and causing just even more pain. So that was not a good assessment technique. And then lastly, she does not give him the call bell whenever she leaves the room. And this is an important thing to note, because once you go into the third video, you see why, because again, we'll get to that part. But yeah, so she doesn't give him the call bell whenever she leaves. She just exits the room, no side rail or anything. So the phase 3 assessment that we did after videos 1 and 2, the things that I noticed that were important in the diagnostics were obviously the vital signs. His blood pressure was up, and some of the lab values, the red blood cell count, white blood cell count, and the bilirubin were all elevated, especially the red blood cells and the white blood cells. It was 12 for the red blood count, which should be 6.1, and it was, I believe it was 15 for the white blood cells, and it shouldn't be over 11. And then the bilirubin, it shouldn't be over 1.2, but it was 1.3, so it was just a little bit elevated. So what I think is going on with this patient, just from, watching, nonverbal cues as well as the verbal cues, I think they have pyelonephritis, which is kidney stones. And I think that because I actually had a project on pyelonephritis, and it was a lot of those kind of warning signs that you see. So additional testing that I think would be ordered would be an ultrasound. A CT was already done, which is most common, because if you order an x-ray, it can't really get those small little fragments that are in there. It can't catch that image. So an ultrasound, and then a urinalysis, a 24-hour urine specimen would be good to see what type of kidney stones are in there. So then we'll move on to video 3. The first thing I noticed was that the nurse was threatening the patient. She would be like, oh, well, you better promise me I'm not going to give you this pain medication if you don't stay in that bed, if you don't fall. And that's just not right. Nobody wants to be treated that way. And then she assumes on the assessment for his pain, she's just like, oh, so it's 10 out of 10. I bet it's 10 out of 10. And really sounded condescending and like she was mocking him. So that was my second one. Third one, she said she's going to make the blood pressure cuff as tight as possible. And that came off threatening to me as well. It's like, I'm going to get this as tight as possible, like as tight as it can go on you. And then the patient afterwards complains of numbness in their arm. So that's definitely an error. Number 4, she didn't actually get she did get the blood pressure reading. In video 2, she didn't. But in this one, the patient asks, like, what was my blood pressure reading? Was it good? And she was just like, it's all right. And, the patient, if they ask, they want to know what their blood pressure is, and it wasn't all right anyway. So that was an error. Number 5, she puts the temperature probe under the armpit, which that specific thermometer is oral. That's not what that's used for. So it should have went under the tongue. And then when she was just like, oh, well, it's not going to go through. We're just going to call it. We're just going to call it 100.5. She says, we're just going to call it. And you can't just call a temperature, that could be a sign of infection or a lot of other things. So we don't want to just call it. And then when she, so that was my 6th point. When she doesn't get the temperature, then she just makes up a number. So 7, left mask at the nurse's station, which even the patient is like, oh, hey, where's your mask this time? And she kind of just responds, oh, I left it at the nurse's station whenever I was taking a snack. I was just eating. So she didn't have her mask on, so it's PPE. And then she doesn't have any gloves on at any point. She doesn't use hand hygiene at all, so that's a big factor. And then number 8, she leaves without watching the client take his medication. So she gets a phone call and takes it, and then she's like, oh, here, take this, and then just leaves the room. So the patient is left with this cup, and it's just like, And on top of that, it's a controlled substance. It's Tylenol number 3, so Tylenol with codeine. So you can't just leave that without actually watching the patient take it. And then the 4th video is kind of where everything comes full circle. So she comes in, it's like, the CT shows kidney stones in there. I've waited 3 hours, so I'm going to go check on the patient now. And it's like, they're in severe pain. You gave them a Tylenol number 3, and it's been 3 hours since you've been to check on them. Like, you should have been back within 15 minutes to evaluate that patient once they've taken that medication to make sure there are not any adverse effects going on. So that's a huge no-no. Number 2, I found on there, she takes too long to just do some things. Like, she realizes that the patient is starting to code, and then it's just like crickets waiting for her to like lower the head of the bed and everything, when she should be, if they didn't have a DNR, she should be getting everything together, get the crash cart, get help. But even all that she didn't need to do, because number 3, she doesn't know that the patient has a DNR on file, which, if she would have started CPR, life-saving measures, that could have been a big deal, because, it had to take the wife being like, hey, hello, like, there's a DNR on file, don't do that, for her to be like, oh, yeah, sorry, no, we're not doing that. And then number 4, the wife has to tell the nurse that he has a codeine allergy after he's already taken Tylenol with codeine. So, big mistake right there. Obviously, we've just killed this patient potentially because of that. So, didn't check for any allergies. And then one thing that I found as an error was that the nurse just like left the room with the wife alone with a dying patient. I feel like she should have stayed there until help arrived. She did yell for them, so they should be there any moment. So that one I wasn't 100% sure on, but just me, I feel like the wife shouldn't have been left alone, with her dying husband there. So those are all the errors that I found. Video number 3, I found actually a lot more, but it said only 8, so I tried to just prioritize and pick out the ones that I thought were most important. And that's this week's video assessment. Thank you.